Do you frequently feel like your heart pounds for no reason, even when you're just sitting down? Or maybe your muscles feel weak and you're tired all the time, even after a full night's sleep. What if I told you these signs might not just be from stress or bad coffee? They could be your body's way of saying your adrenal glands are overworking. Meet Conn syndrome, also known as primary aldosteronism. It's a sneaky condition where your adrenal glands, two small hats sitting on top of your kidneys, produce too much of a hormone called aldosterone. This hormone helps control your salt and water balance, but too much of it causes your body to hold onto salt and dump too much potassium, leading to high blood pressure and other odd symptoms. Think of it like a broken faucet inside your body, always running, raising pressure, and wearing down the pipes. And guess what? Many people with high blood pressure might actually have this condition and not even know it. So what causes this hormonal overflow? Most often, it's a tiny, non-cancerous growth in one of your adrenal glands, kind of like a small button growing where it shouldn't, telling the gland to pump out aldosterone nonstop. Doctors call this an aldosteronoma. In other cases, both adrenal glands might be overactive from the start, like twins who both decided to shout at the same time. We call this bilateral adrenal hyperplasia. Rarely, there can be genetic reasons passed down in families where the body's system for managing salt is wired wrong from birth. Imagine your body's salt control switch is stuck on high and won't turn down. No unhealthy diet or lifestyle caused it. It's just how the body's chemistry turned out. Importantly, it's not caused by eating too much salty food, though salty food can make symptoms worse. Now, how would you know if something like this is happening? Here's a fun test. When was the last time you had muscle cramps or felt weak while climbing stairs, not because you're out of shape, but because your legs just didn't want to work? Low potassium from Conn syndrome can cause that. Or maybe your blood pressure stays high, even though you take medication, eat healthy, and avoid salt. Ask yourself, are headaches becoming a daily guest? Do you wake up multiple times at night just to pee? That's because imbalanced salt pulls water into your blood and makes your kidneys work extra hard. Some people even feel heart flutters or palpitations. The tricky part, many think, it's just aging or stress. But if you're on 2 or more blood pressure pills and still not under control, your adrenal glands might be the real culprit. Imagine your body is a machine, and we want to test one of its sensors. First, they check your blood, specifically the ratio of aldosterone to renin, a hormone that should balance aldosterone. If aldosterone is high and renin is low, alarm bells ring. Then comes confirmatory tests, like asking you to eat a high-salt diet or getting your blood drawn after being upright for a while. If still unsure, they might do a CT scan to see if there's a tiny growth on one adrenal gland. In some cases, they even take blood directly from the adrenal veins. Yes, tiny tubes guided through a catheter to find which gland is misbehaving. If it's one side causing trouble, surgery to remove that gland can cure the issue. If both glands are overactive, you'll likely take a pill like spironolactone, a medication that blocks aldosterone's effects, like putting a mute button on the loud hormone. Most people see blood pressure drop and energy bounce back. It's like fixing that leaky faucet we talked about. Can you avoid getting Conn syndrome? Well, since it's mostly caused by growths or genetic factors, you can't truly prevent it like you would the flu. But here's what you can do. Pay attention to your body. If your high blood pressure doesn't respond to medicine, speak up. Ask your doctor, could this be more than just lifestyle? Avoiding excessive salt can help manage symptoms, and regular checkups can catch imbalances early. Think of it like car maintenance. You can't stop parts from aging, but you can catch issues before they cause breakdowns. Knowing your family history matters too. If a relative had adrenal issues or early onset high pressure, mention it. Awareness is your best tool, because the sooner it's found, the sooner you feel like yourself again. Exciting news! Scientists are getting better at spotting this condition early. Recent studies show that up to 10% of people with high blood pressure might actually have Conn syndrome, way more than we used to think. New blood tests and imaging tools are making diagnosis faster. Researchers are also studying genetic screening, testing for faulty genes in families where multiple members have the disease. Even cooler, new drugs are being tested that target aldosterone more precisely, with fewer side effects than current ones. Imagine a future where a simple genetic test could alert you years before symptoms start. That's where we're headed. One day, Conn syndrome might go from misdiagnosis to caught and fixed early. And you could be part of that change by simply asking